Services, and we are now open to questions for the director. Who would like to begin?
We have stars down here. So it's on that half of the room.
Okay, well, I'm gonna stir some up and see what that leads to. My first question is, what significant innovations have come out of the Senior Center Innovation Grant Program? And have any of these been expanded to other senior centers other than the grant recipients?
Well, first of all, I'm thrilled about the senior innovation work. When I was in this role prior, I felt it was important to support new initiatives and new projects. So right now, we are currently funding two particular partnerships, one with University Settlement to support their medical care model, as well as, I believe it's Euclid Senior Center, who provide meals over long weekends for many of the residents that attend their senior center. And so those programs have gone well. We have extended the funding to the end of the year. We will be issuing a new RFP at the beginning of the year to really give me an opportunity to help shape some of the innovative work that's out there that we want to support and fund.
And do you foresee any of the innovative programs being patterned and spread to other senior centers, or are these like one-shot deals?
I think some of them have the capacity to expand for sure. The medical model is one that is very interesting and is promising that I think other senior centers can build on. They have a strong partnership, I think it's with university hospitals, where they are doing health assessments for seniors that is attending their senior program. I think that is an ideal model that could be expanded. We also supported a few years ago, it was called CARE. I can't remember what the acronym stand for, but it was a collaborative with some residents in Solon and some other municipalities in that area to provide some housing renovation support. We know that senior housing has been a priority issue for us in terms of providing support for home renovations, and that program has gone really, really well.
And is the list of senior centers that we're working with, is it the same as what it's been? Is the proposed budget for 20 and 20-1? It's the same as what it's been. There's no new centers added and no centers deleted. Is that correct?
You are correct.
Okay. And what programs does your department currently fund to help with senior transportation?
Through our options program, we have a contract with STC for roughly around $95,000 to provide medical transportation for our option clients. And also we have some of our senior centers who contract with STC directly, and we reimburse them for their funding.
Okay, fine. And why did the Health and Human Services levy for senior and adult services go down by about $3 million from 2018 to 2019 as presented in the departmental pages in the budget book?
Yeah, I'm going to ask Walter to respond to that.
I'm not sure that I can respond to that. Honestly, I would have to look into that, Councilman Miller. I don't know.
Okay, we'll
I'm
let
not
you.
aware of any additional revenue that was received. It's primarily Title 20, Adult Protective Service, and Social Service Operating. None of that has changed.
Okay, it's quite clear in the book.
I will give you an answer.
For 2018, the levy subsidy is $20 million, and for 2019, it's $17 million. So we'll let the director find out for us. So, any other questions by my colleagues? Ms. Baker.
If we can get some clarification on the options program, there was an ask of 800,000 for 2 years, 1.6 million, that was denied. And I think you said in your testimony, unless I was misunderstanding, that, did you say you went from 600,000 to a 2.8 million in options funding? Can you explain, where we're at with all
Yeah,
that?
absolutely. We were at $2.2 million with over 300 individuals on our waiting list for services. And just recently, 600,000 was added to our contract. So that increased our budget to $2.8 million, allowing us to eliminate the existing waiting list that we have in place.
Good,
And
that's good to hear. So to follow up on that, why was it an additional 800,000 asked for and denied, and why was it needed if we have solved our waiting list?
So the options program is very unique. While all of our clients are receiving some service within options, we have a pool of clients who are still waiting to receive homemaking services. And so with our existing budget, if we provide everybody everything on their list for services, on their service plan, we would exceed our budget. And so we were requesting an additional $800,000 to address that gap, to make sure everyone actually receive all the services that they are eligible for, in addition to serve additional clients that are interested in the program but have not been able to access services.
So you are in favor of asking for additional dollars because you feel that the services that we're providing are not all-inclusive, and that we could be doing better with our seniors if we added another 1.6 million for 2-year budget. Is
Yes.
that clear?
Yes.
Okay.
So that would increase the annual spend to 3.6 million for this program, is that correct?
Yes.
Okay, Councilman Gallagher.
And maybe, hopefully you can help me. We keep hearing about population. What's the population of seniors in Cuyahoga County?
It's about 272,000.
And are you familiar with the next largest population in Ohio?
I think it's Franklin County.
And do you, offhand, I won't hold you to it, but where are they at?
I don't know exactly what their population is, but I can tell you how much they're spending on their per capita per senior.
I know how much they're spending, that's where I was going. They're about 100,000 lower than us, might be around 90,000 lower than us. Why don't you tell the world how much we spend per senior and how much Franklin County spends per senior, understanding that Franklin County has many less seniors?
In Cuyahoga County, we spend about $55 per senior, in comparison to Franklin County, who is spending $159 per senior, as well as Hamilton County, who is spending about $137 per senior.
And to be fair about it, the Franklin County does have a senior levy. And then money is added to that to provide even more services. I would just ask my colleagues to really think about that one.
Okay. I agree, we should think about it. And we should do something about it. We should do something about it.
Mr. Chairman,
Yes,
just right along those lines, since the councilman referenced
She wants your mic on.
I'm sorry. Since the councilman referenced the senior levy that they have there, are you familiar with their health and human, the equivalent of their health and human service levy in Franklin County? Does one exist? No. Okay.
I don't think, yeah.
I think that we need to see the whole picture. They've obviously prioritized seniors, more than we have. But we may be doing, we do a lot of other things that they do not do.
okay, Councilman Gallagher.
To answer the president, They don't have anything like Cuyahoga County, which I will say, in Ohio, if not the United States, is one of the most generous counties to people in need of health and human services. Franklin County put the senior levy on the ballot, and it was rather political, and people fought it like crazy. And if I'm not mistaken, don't hold me to this, I think it was 79 or 76% of the vote went to the senior levy. And those of us in politics, you don't see numbers like that. Those are so odd and rare. So obviously the folks in the Hamilton or Franklin County with pushback still gathered in the high 70s percentage to pass that levy for their seniors, which I obviously strongly believe would happen here, but the dollar is stretched as far as it can right now, so we have to figure out something.
To the chairman and to the back to the councilman, it would seem that if the demographics that we've been presented with today are the case, that that would be an inevitable follow-up. That would be inevitable that if a senior levy were on the ballot, that it would have tremendous success.
To the president, my argument has always been is that not only would seniors vote for it, and we all know anybody that's run for elected office, be it local or countywide or statewide, seniors vote. They get out and they vote, and seniors for the most part have children who have children. And I can't imagine someone not voting for mom and dad, and I certainly can't think of anybody that wouldn't vote for grandma and grandpa. So I think the moment the polls open, it would be inevitable.
Chair.
Yes.
So to compare us to Franklin County, though, I mean, we can think about that comparison. We're so much different here in Cuyahoga with the poverty in the city of Cleveland, and we're just so different in terms of the needs of Cuyahoga, so far stretched, and so I don't think that's a fair comparison, frankly, on this end. I mean, not to diminish the need of seniors everywhere, but we just heard about the foster care and how we're stretching our levy to cover this crisis. That if we start to look at all the comparisons between us and Franklin, I think we're going to see a lot of different numbers just to inform us when we compare us to them. But certainly it's important to pay attention to what the trend is in terms of our aged community and in the U.S.
Absolutely.
I would agree with Ms. Simon that the circumstances are different between the two counties, but also we can find the $800,000 a year for the options program. The seniors need and deserve the services. Other questions for the director? Thank you very much.
Thank you.
Okay.
Sorry, I guess I was neglecting my duty and forgot to introduce Tracy, but now we'll have David Meerman from Job and Family Services.
Good afternoon, David Meerman. I'm the Assistant Director of Health and Human Services, and I'm here on behalf of Director Kevin Gowan. Unfortunately, Director Gowan was called out on a family issue that he could not control. So if there are items that I report out today on his behalf that he wants to amend, I'll ask him to do so and to direct any sort of corrections or changes to Councilman Miller and your colleagues. If there are questions that you have that I'm unable to answer, I'll also turn to Walter. So I'm here to present on behalf of Cuyahoga Job and Family Services. JFS has an annual budget for 2020 at $80,055,296. This is a slight decrease but it essentially represents flat funding. We have the same number of FTEs, 853, that we had in 2019, and we offer the same services. There was an increase of staffing in 2019. Earlier this year, Kevin addressed the increased work volume that had become more transparent as a result of the move to the new contact center environment. And he brought forward a request and was given 20 additional FTEs. The reduction that does exist in this year's budget is largely a reflection of the reduction in healthcare costs. JFS primarily responds to the major public assistance benefits programs, SNAP, which is the Supplemental Nutrition Assistance Program, TANF, or the Temporary Assistance for Needy Families, subsidized childcare, which is largely funded by TANF but also has some state money in it, and Medicaid. In terms of changes, no programs are being eliminated at this time. There was no significant increased expenditures. There is an expected COLA that has been built into our budget. And I understand that there was a request for us to lay out the 3 priorities from if new levy dollars were available. I do believe Walter has already referenced them, but I'll review them anyway. The first is the parking for staff at the Virgil Brown Building. And I think that would be parking for both the job and family services as well as child support staff, and then the other supportive service staff that is also in that building. The second is following an assessment, looking at if we have enough FTEs to manage our contact center to get to the level of call time that is a focus of the county. And then the third is the tuition assistance or reimbursement. I think that request came in Job and Family Services, and it was at least included in our budget, although it would affect other departments as well. In terms of 2020, there are a few initiatives that I should be reporting out on. I think the first is continued implementation of our contact center. This is something that we initiated back in 2015, and we have continued to add to that program beyond the 20 staff. We are getting really enhanced productivity and forecasting through software that we have developed as well as been provided to us by the state. This has actually been a tremendous enhancement of our abilities, and it has put us in a position to be much more responsive. We are also doing a much better job of distribution of the workload. Cases that come into the county are now being sent to centers that are specializing in the policies and practices of those special cases, which is not to say that each of the centers doesn't answer other case questions. In fact, all of the centers that we have answer questions for all of the programs. However, centers are given the ability to focus on a specific program area. We also want to talk a little bit about Medicaid and our tremendous partnership with the state of Ohio. The Ohio Department of Medicaid has granted us 2 special allocations in 2019 that have yielded over $1 million of additional operating dollars. This is, I think, it's worth just recognizing. We feel like our partnership right now with the Ohio Department of Job and Family Services and the Ohio Department of Medicaid has never been better. This administration has been an excellent partner and is working with us to address areas where we see either deficiencies or growth opportunity. And I feel like the table is set for the near future for us to continue to have an exceptionally strong partnership with the state of Ohio. And the last thing that I would add in terms of our work programs, we have new contracts that started this summer, both for our adult TANF population as well as the youth and young adult population. Those programs began to be under new contracts in the spring of this year, but most of the new contracts began in July. And we're especially excited that this year, for the first time, we jointly RFP'd and contracted with Ohio Means Jobs for our youth programs. So we now have common contracts with Ohio Means Jobs. We're braiding funds. We have shared metrics. We're doing shared provider management. We think that is a very client-centered approach because it allows us to look at each client coming in and assess their needs and be able to address those needs out of the best available funds. We also believe it's more efficient for providers. It's one set of relationships, one set of contracts to manage, as opposed to one from us and one from OMJ. And lastly, we think it's an opportunity to provide leadership to the community, showing that the county is now integrating services in a new way, and we certainly hope that others will as well. So those are the principal items that I wanted to report on, and I'd be happy to answer any questions.
Okay, thank you very much. Questions by my colleagues? Ms. Conwell.
Through the chair to Mr. Meerman. So there was some, with the YOU, or with the WIA contract and Ohio Means Jobs, where are you in terms of being inclusive with the Office of Homeless Services? I know we've had conversations with Director Gillette and to really, and I think the last time that I spoke with Director Gillette, it's basically having, I don't know what their titles are, the individuals that work in Ohio Means Jobs, but connecting them, a coordinator.
That's
Maybe
right.
that's it, a coordinator with the Office of Homeless Services. So, I mean, we see homeless, and I think many of us just think that these individuals are, you know, they come with all kind of problems.
Yeah.
But, you know, there's many talented people there that need a leg up, and I really want to see that. I mean, I've talked about it, but when we look at the dollars that we're spending in Office of Homeless Services, we need something on the prevention side and something on getting them out. So what can you share with me about that?
To the councilwoman through the chair, I think I would break it into two subpopulations, if you will, and I apologize for having to do that, but unfortunately, that's how much of the funding comes to us. As it relates to youth, young adults that are homeless, generally speaking, we have specialized programs for them. An example of that is the CCMEP Comprehensive Case Management County Internship Program. We have told the homeless youth providers, as well as the providers with young families, anyone in your system gets a subsidized job, and those subsidized jobs all lead to offers for paid training and education, counseling, case management, coaching, and then placement based upon the completion of whatever training they enter. I feel like that's probably our best service at this time because it tries to anticipate a person really moving through all the stages of employment. It starts with paid employment. I think that's the best way to initially respond to a person coming in. They're generally looking for a job right now. Let's give them a job, but use that opportunity to get their interest in getting training and education and then support them through that. So we have said to the providers that serve homeless youth and families, if you have someone that you're serving, give them to us and we will put them in our program without any sort of lottery, right? They go straight in just based upon who they are. And the same says for youth that are aging out of foster care because we see many of those youth are at higher risk to become homeless in time. So for youth and young adults, I think we're doing a lot and we can do more. So I know that Paul Bounds and Kevin's staff is meeting regularly with the teams and is engaging them to say, you know, okay, let's try a new outreach strategy. Let's see if that works. And if necessary, let's make some adjustments. And then we'll see if there needs to be improvements. So that's youth and young adults. If I can say a little bit more about non-youth and young adults, and largely this is single men and women. We can also recognize many of them may have families. They may not be with them. So we are really thrilled that 2 providers are going to be coming on board with us through our SNAP 50/50 program. There are a lot of acronyms here, so I apologize if I start to throw them around. But this is an effort that we have initiated over 3 years where we identify when service providers are serving a special population that we're interested in serving. And they are currently providing the entirety of the service. And generally speaking, because they haven't developed that service with all the restricted funds that we have, their services are more responsive. And a lot of times they're possibly truer to the needs of that individual. What we have done is we have begun this new SNAP 50/50 third-party reimbursement program. It's a mouthful. And what that does is when a provider is serving a population, they submit their client roles to us. We go through their client roles, and if we see one of our SNAP clients is among the people they're serving, we are able to give them a 45% reimbursement of their costs. They're already putting out 100% of the funds. We give them money on top of what they've already spent, and they can reinvest that into their program. And I can tell you, 2 of the 3 providers that we're we're going to be presenting for expansion into that program are homeless providers. It's the Westside Catholic Center and it's Lutheran Metro Ministry. We feel like that's a really important way for us to start to build capacity within the homeless community to help their programs grow and succeed. And what I've heard from them is they feel that's important because it gives the providers the experiences they need managing county budgets, working with us, dealing with eligibility without the heavy administrative costs of immediately jumping into TANF. At this point, if they submit us a list and no one on that list is a SNAP client, they're not out anything. They've already funded the program. It's just a question is, do they get additional reimbursement that they haven't budgeted? So we're already really addressing youth and young adults, and this new approach will expand our interest and our footprint within the adult homeless community.
More like the single adults.
That's right. And we hope that'll grow because at the national level, this is one of the largest untapped funds for workforce services. And we have a lot of confidence that this is going to be a successful program.
Do you think we should expand that with the seniors? Seniors, homeless individuals. I really cringe when I have to think of a senior in the home. And we do have a senior program with DSAS.
Yeah.
And I don't know if every senior wants to go back to work. Obviously that's their choice. But is that something that?
It's a great question. When we released the RFP for the TANF services, we did ask providers to highlight if they were providing services to seniors, if they had models that they had worked out. I don't think we got any reaction. And then when we released the second opportunity for that SNAP program, I also don't think we got much of a reaction. I do believe, though, that both of the two programs that I referenced, they do serve a good number of older adults. I don't know that I would call them seniors. And so, this is where, until we implement it, we don't know. These could all be individuals in their 40s or 50s, or these could be individuals 50s, 60s, and 70s.
40s and 50s are not seniors.
Well, we won't know until they get going and we see how it goes. But I think it's open to it.
Thank you.
Other questions? Ms. Baker?
Yes, and thank you for your work out there. I know it sounds like you really have a lot of innovative ideas, and they're paying off for you. The three pieces that you were asked in your what would you like to add to the HHS levy if you could? And you put down, I heard parking a couple of times at the Virgil Brown building, so put a number to that. How much are you actually wanting to invest in that if it were to be added? Are we talking a lot of money, or I can't imagine it being that much?
I'm going to let Walter, Councilwoman Baker, I'll let Walter answer that.
Councilwoman Baker, it's $720,000 would be the request. We would get reimbursement of $346, so the cost would be about $374,000.
Okay, that's good to know. And then if we can just kind of confirm on that contact center, we have 40 vacancies right now, which are already in the budget to allocate funds for that. So are you talking, when you say you need more funding in the HHS levy for the contact center, is that in addition to the 40 that we are trying to fill?
To the Councilwoman through the chair. So it could be. It could be an addition. I think part of what we're trying to explain is that we are still in the first year of full implementation of this new model. We've just been given these new tools that help us to do the analysis of our services. And we think after a full cycle, and once we are at full staff, like once we bring on those 40, and we can actually see how the system will perform at full staffing, and we have the analytic tools that the state is going to provide us, we'll have a better sense. Can we get to the goal of a 5-minute wait time?
Right.
We've never been at full staffing, and we've never had the quality of the tools that will let us make that decision.
So to ask for more funding for the contact center when we have 40 vacancies and tools that have not yet been totally used, that might be a little, maybe ahead of yourself then in asking for more at this time, given that we haven't really played out the 40 vacancies or the additional tools that you have had to work with. Is that a fair statement? I mean, I don't want to add more to the HHS levy when we may not even find that we need it.
again, to the councilwoman through the chair, I definitely would not make the request at this time on Kevin's behalf, because I think we do want to have we want to have full staffing, and we want to continue to see if how this model performs when it's at full strength, and then do the analytics and be able to come back and say, at full staffing, at full strength, maybe we can get from a 16-minute wait time down to a 10, down to an 8. And then I think there can be a discussion, is that the appropriate wait time? But there is this thought, it would be great if we had a 5-minute wait time. And, and I think that sounds like a lofty goal. And I'd always couch that by saying that would be a goal for an average. There are always going to be times that our wait time will balloon above that around lunch. Lunch tends to be a time when, we see our individual wait times go up. Around holidays, those can be tough times. But there are also times right now where we have a 0-minute wait time. I mean, there are days right now where our programs could have no one waiting. And so I think the goal is to get to a sustained average and to be able to use the tools and resources we have to determine, what is the right staffing level. And we just haven't been able to get to that point yet.
Are you confident that you can fill those 40 vacancies?
I'm actually very excited to report that, like Director Weisskettel, Kevin did a hiring event at Cleveland State University, and they got over 300 applicants. So very, very positive. They went out into one of the major schools. They brought along staff that are doing the work, and we have over 300 applicants right now in this robust economy. And I think the other thing that they did is they redesigned their posting for the position to be much more direct about it being in a call center environment. We don't want people coming in to think of us as being the same as child welfare, which is case manager, so much more social work like in its work, and many of them are social workers. This is a high volume call center, and it has a very, very distinct skill set. So Kevin and his team have worked closely with HR to do recruitment for that job, and to get 300 applicants in is really great.
Yeah.
I would also just like to recognize the 40 open FTEs right now. That does not include the 17 staff that are currently in training. So we're going to have 17 out. We'll have another class beginning in December. We're going to be hiring from that candidate pool, hopefully of 300 for that December. And I just, I'm confident that we can get closer to full strength. We've been there before, and then you see everything really change.
Good. So we'll wait to hear from you as you keep fulfilling that goal.
Yeah, from Kevin, from Director Gowan, of course.
Kevin. The third one was the tuition assistance. What is that? What is a tuition that you gave as a third achievement?
So I'll ask Walter if he wants to add to this as well. But so other programs within the county in the past have had tuition assistance reimbursement. So if a person goes to school and they do well, the county will pick up and reimburse for a portion of their out-of-pocket costs. We've seen in the past it's been an important way to help staff get advanced education, possibly explore new careers. And we know there are fellowships in child welfare that do some of that, but they're specific to funding sources. So I'll ask Walter if he wants to add anything.
That was about $1 million. We were expecting a 50% reimbursement. But just to be clear, we asked for that for all of HHS, not just for Job and Family Services.
So it's 1 million for all of HHS.
Correct.
Okay.
And it would be for, undergrad degrees that would lead to, something close to their field of work, whether social work, casework, support officers, whatever program they were administering.
And this is these are our county employees you're talking about.
Of course, yes.
Okay, thank you.
Questions? Okay, I have some additional questions. First, on the call center staffing, do we have a turnover problem? What's the rate of turnover in that area?
So what has been reported to me is that we lose about 5 staff a month. And, I do think we're tracking it now that we're in this.
That's out of how many?
Excuse me. We have 358 staff that are, I'm sorry, let me say it again. 858 staff in Job and Family Services. We have around 350 eligibility specialists, and we lose about 5 eligibility specialists a month.
So that's about 15% a year. That's not insignificant, but typical. Okay, turnover, 15%. Okay. Have we made any progress on helping Cuyahoga County get access to SNAP benefits? The last set of statistics I kept hearing, and I saw a number of monthly iterations, and we would get something like 30 to 40% approved in the 30-day time frame. I think that's the time frame that they're supposed to be approved in. And then you get about 30% that eventually get approved, but it takes considerably longer, and you get 30% that get denied for one reason or another. So and these are people that on the face of it look eligible. And are we doing any better than that, or are we still kind of stuck there?
Councilman, we're doing better. I can say that every day we get around 4,500 calls into all of our programs. Really, I have to just say there is no other program in all of county government that has the volume that we have on a daily basis. And in our peak times, we can get 90,000 calls in a month. So when I talk about us doing better, it is doing better at scale that is nowhere else comparable, in my opinion. And in terms of since the state implemented the new case management system, the Ohio Benefit Worker Portal, or OB, as we like to call it, our SNAP timeliness rate is at a very high level. Overall, it is probably the highest level we've had since the new system has come on board. I do want to speak to your point about the different standards. When a person walks through the door and they do a SNAP application and they literally have no income, no resources, the obligation is that we give them a determination within a week. And it is a very hard goal, simply because the expectation is that we achieve it 95% of the time. So nearly perfect. And unless the person is calling in with all of their information in front of them, it is a very hard goal to reach, because if we ask them for any other additional information, we have to send them a letter letting them know that we need that additional information, which goes out through postal mail and accounts for all of the mail time necessary and has to be given with a few days' notice. So when someone calls us and they have all of their information together, we do a great job telling them, yes, no, you get benefits. But if their information is not together, we do have to account for mail time and processing time, and it can be very difficult to meet that 1 week time frame.
So can you get me an update on recent statistics on what our SNAP results are?
So I can share that looking back in 18, we did have at one point a backlog of 6 weeks for SNAP applications. This is when we implemented the new system. Right now, our SNAP backlog is 2 days. So a real significant improvement. And we have a very, very, very effective application tracking system that we built ourselves that helps us manage that, to find cases to make sure that nothing gets lost. I would like to explain why something could get lost. On Medicaid, there was a period last year, this was in 18, where we had up to 12 weeks in our backlog. Right now it's 2. So we are doing a much better job at backlog management and application timeliness across the board. And that's a part of the reason I believe that we have this new strong partnership with the state of Ohio, because the state sees it. And when we go to the state and say, hey, listen, we've seen a significant increase for one reason or another, we want to tackle that with overtime. They have supported us with resources that allowed us to really work through any sort of problems.
So, can you get me a number on percentage approval within 30 days?
I can ask to see if that's available. And so what I think is part of the issue on that question is the state does not, I'm not sure that the system reports an effective denominator. We're generally not tracked on how many we disapprove, but we are tracked on how many we approve. And so I'll take that back and I'll ask for it and I'll see if we have that information available.
Okay, and the projected SNAP enrollment for 2020 and for 21, and also for 19 is 200,000, where the actual for 2018 was 222,000, as reported in the budget book. Can you tell me why the projected number of recipients is less than what it was in 2018?
So broadly speaking, and I'll ask Kevin to chime in on this when he's back, there has been a decrease in the number of households receiving SNAP throughout the state of Ohio. We're not entirely sure why that's the case. There is a sense that some of that is due to the economy. We tend to see that as the economy improves, less people are on SNAP. But there is also a reality that the new system that we are operating out of, OB, or the Ohio Benefit Worker Portal, has something called auto discontinuance. This is a feature that you may be familiar with from Medicaid. And the system is now engineered so that when a person gets to a point in their case, if they have hit an eligibility date or a redetermination date and all of the information is not present in the system, or they have some outstanding obligation, the system will automatically disenroll them. In the past, that was something that a worker would go through and do manually, and we would get a report from the state. Here are the individuals who have missing information, and we would make a decision. We don't have that freedom anymore. The system does that automatically. And, from an individual's perspective, that generally results in them coming back for additional application if they disagree. So you do see some churn, but in the short term, you see these big drop-offs. And I'm wondering if a part of the reduction in the number of caseload that you shared are related to that. Just this is the new normal between the economy and auto disenrollment.
So on SNAP, how frequently is redetermination required?
So, Councilman, it's an annual redetermination process that you have to apply every year. You have an interim report that you're also required to complete, so halfway through the year. And I do believe there is also a 4-month check-in, but I don't feel as confident right now in whether it's 4 or 3 months. So we'll have to get back to that. I'll get back to you on that.
So you're saying potentially once every 3 months somebody could get automatically disenrolled?
That's the question I'll answer with Kevin.
Okay. And can you find out how many Cuyahoga County SNAP recipients have been auto disenrolled in 2019 year to date?
I will ask.
Okay. I think SNAP is kind of foundational. People need it to survive, and if people can't get access to SNAP, well, then the food banks get overwhelmed and they can't respond to what's out there, and it just upsets everything. So we gotta pay close attention to that.
It does. Councilman, I meant to also explain one other point I shared earlier in terms of the change in our model. We did move to this case bank model, and part of the value of going to a case bank model, no one is assigned cases. You take the next call that comes in, but there are these concerns that you could then lose cases. And, you know, when I shared that we've had this dramatic reduction in our backlog, every time we focus on our backlog, I will say you'll see that our application timeliness figure dips because we've gone through and found, oh, there's an old case here that somehow got missed. Well, let's clean that up right now. And so if I can just say this, yes, SNAP is a foundational program, so is Medicaid, as is childcare. And I think what we've been doing using this new system is we have, actually I should say systems, both the call center and the OB system. It's giving us data, it's giving us tools and resources to manage the cases in a way that we've never had. And I think Kevin Gowan and his team have been more effective in that management than anyone before them. And I actually think the best is yet to come with them. Because we're just a year. I mean, SNAP has only been in this new system, and it's only been in this new call center for a year. And he actually did much of the restructuring in January, February of last year. So it's not even a full year in the current system. And I would argue that once he's at full staff and once he has the time to really learn what occurs through any implementation, to make adjustments, to make improvements, you're going to see this system continues to improve as it's improved dramatically already.
I would be encouraged if the SNAP enrollment is going down because the economy's better. We've had a lot of years where the economy got better, but yet the food demand kept going up anyway. So if that were to reverse itself, that would be encouraging. Is JFS involved in the county sector partnership and skill up programs, or are those completely outside of JFS?
So, Councilman, we talked a little bit about the TANF and the CCMEP programs, and we are still working through how to send residents that are in those programs to the sector partnerships. We're in discussions with OMJ, we're in discussions with Department of Development, and we want our clients and we want our residents to be given the opportunity to explore careers in manufacturing, healthcare, and in information technology. So I think the answer will be yes. I can tell you right now, for the county internship in the past, our largest sectors, to my memory, that internships occurred in were healthcare, and I believe there was a significant amount of manufacturing, less amount of information technology. So I do think we've had a role already, and we want to see it grow. We want to see it improve. And part of what we're looking for is for our area employers to tell us what exactly they want from us, not for us to make assumptions about what their needs are.
And is the economy sufficiently strong that anyone who has basic math and literacy skills plus the necessary soft skills to work effectively in the employment environment can get a job, or are there still a shortage of jobs for people who need them?
Councilman, I'm not sure that I could answer that question just as I'm not an economist, but what I would say is that we are hearing that getting a job is not, broadly spoken, the issue. Now, there are people that are still coming out with felonies or criminal backgrounds or physical disabilities or other barriers to employment that this wonderful economy's jobs are not being open to. So I definitely don't want to say that anyone can, because we know that's not the case, but we know more are. And we have many employers saying they will take risks on people that they may not have in the past. I think the bigger issue is what are the nature of those barriers? And if it's training and education or it's basic skills, getting a job and getting out of poverty may not be the same thing anymore. So
Absolutely.
It's the ABCs as often described. It's any job, it's a better job, it's a career job. Having someone get any job is not the challenge that it was 10 years ago. It's still a challenge to get a better job, and it's definitely something we need to make more investments and pay more attention to, are the career jobs, because those are the ones that really have people leave our programs for good.
And Director, I know when it comes to handling my cable TV services that I sometimes have to go down to their office and talk to a live human being, and I usually do much better than trying to do it over the phone. My question is, have you done any study or to find out whether the people that are using the call center are doing just as well and can get a problem resolved just as easily and quickly as if they try to go to a site and do it in person, or have we not quite navigated that problem?
Councilman, I'm not aware of a study having been done. I will say we've just started to get the full data from the state on the call center. Some of the things that we've heard, and I'd ask you not to overplay the value of anecdotal evidence. We have heard that many people get on the phone and come into the center at the same time anyway. Or they go through the phone process and then they go down to the center to make sure we got it. And if I may, I think there are still times that some people don't trust our system. And I think we're going to have to go through a good full year or maybe two of success to really build the trust that people are counting on. And I think the lack of trust, some of that to me can be associated to the auto disenrollment, policies like that, or like last January, February, when there was discussions about just having SNAP disrupted during the budget process. This may not be our decisions. They define our relationships, though. So I think we're going to have to show a good year or maybe two of really high quality services to build the trust that people will then think, well, I submitted my documentation, they have it, they need 5 days to process it because I'm one of 4,500 that reached out that day. And I don't think we've gotten there yet.
You have. I think it's a useful area of inquiry, and you should work on it. Because I think you have two challenges that you're dealing with. I think, and it just kind of relates to human nature. You know, I think that, I mean, I deal with people around various customer service situations quite frequently, and sometimes people go out of their way to help you out and find a solution, and sometimes they kind of do the minimum, which usually isn't enough to solve the problem. And there's two things. One is if you can look someone in the eye face to face, you're likely to get a better response. And if you have a situation that requires multiple contacts to resolve the problem, you're going to do better if you can have the same person helping you through it step by step, as opposed to if you have a different person helping you every time. Well, your call center model is not face-to-face, and it's a different person helping you every time. And I think there's just built-in challenges to achieving the same level of effectiveness. And so I think it would be important to try to get a handle on how well you're doing, and if you're not doing well enough, how to make it better. You know, I think it's a very important goal that the wait time be 5 minutes or less. I think that is very important, but it's also important as to how often do they quickly and effectively get the problem solved for the person who's calling, and you should go out and get some information on that.
Duly noted. I would add that, so I think it was 4 years ago that when I stood before this table, I heard from Councilwoman Simon, I heard from Councilwoman Conwell, the demand and an expectation that, having residents call our system and no one answering the phone or not being able to get through to a live person was simply unacceptable. And I would say at that time, I fully agreed with them and committed to developing a plan and developing a system so that when a resident called us, someone would always be there to answer the phone. And I would say we have that. Now, definitely, we're going to continue to improve it, and it's not where we want it to be. And I believe when Kevin Gowan goes around and he says that, he sincerely believes it. And if there's someone that gets stressed out over the long wait times, it's him. I mean, he takes it very personal. And I would also agree with you that there will always be a need for a face-to-face interaction. And so we've continued to have that be available. Any person can walk through any of our doors and talk to someone and get their needs met that has the eligibility specialist staff sitting there. But, I would just recognize that we've designed our system to serve the vast majority of the population. And we know that there are special populations that will need special resources. And I think we're looking at how to do that. And as much as, as much as technology can in fact at times hinder action like these auto disenrollment, it also can be a great resource. Many people are now getting passive renewal. People that submit an application in Medicaid, if everything is in and everything is in order and nothing changes, they may get another year of Medicaid without even applying. And so I do think there's some balance and there's some give and take. I think if there was something that I would represent Kevin on, I would say it is customer service. We understand that that's what defines us and are committed to seeing it continue to improve. And I believe Kevin is doing a lot and will only do better as time goes on.
Director, final question. You said almost half of the cost for the parking could be reimbursed. Who would do the reimbursement on that?
Councilman, I'll let Walter answer that one.
Councilman Miller, those costs are charged, through our cost pool. About 50% of our work is in SNAP and Medicaid. Those two open-ended funding sources would pick up those costs.
Okay, that would be good. Okay, thank you. Other questions? Councilman Schrein.
Just a comment. I do want to congratulate, because I do remember you standing up here 4 years ago talking about a program that was in complete disarray. And to say that you've moved it down to 5-minute wait times, that can only be applauded. And that is how we are going to get more efficient with the same number of people. There's just no doubt about that. That is a performance issue, that we set that expectation. I mean, there's not a person in this room, I believe, that probably goes to an airline attendant to get an airline ticket anymore. We just don't do it. Matter of fact, I can only envision the next wave is going to be a certain number of folks who are going to do a lot of it with this device in here. I mean, this didn't even exist, for all intents and purposes to any degree when you started this project to the way it is being utilized today. And so you're going to use it. You're going to put an app on there, and there'll still be a few people that want to see eyeball, but so much of what we do our banking that way, we do our airlines tickets that way, we do our theater tickets that way. Just go fill in the blank. And a voice-activated system, I just think, is probably the next wave that you're going to also find, because if the number of people are now only focused on those critical problem ones, they can do a better job with those few people who need it. Absolutely. And the ones who don't need that service can get it done much more lightning fast. I just had the exact example today with some of my own personal stuff on my own finances and stuff like that for retirement. And the Social Security office just is doing a phenomenal job electronically and digitally. So congratulations to you from where you came from 4 years ago to where you are today. That is what we need to do. When we talk about technology improvement, this is exactly the example.
If I may, thank you very much. All of the credit goes to the staff that are doing this.
Of course
work.
it does. It doesn't go to you.
Okay.
No, I 100% acknowledge.
Yeah.
You set the goal and then they achieve it. That's really what management's all about.
Middle management. I mean, people joined Job and Family Services to help people. They thought they would have a caseload. They're working a call center. It's a different job and it's not for everyone. But when we engaged them and we said, how do we get more efficient? They had nothing but great ideas and a willingness to work this out. So a big nod of the cap goes to the eligibility specialists, the clerical specialists that are working in our system. They've done an outstanding job. And I will just say, I agree with you in terms of the next phase in technology. We're exploring, if a senior is on Medicaid and Social Security, why do they have to do a SNAP application? I mean, if their income is such that they're on Medicaid and Social Security, shouldn't technology help us determine, aren't they eligible for SNAP? So we agree, and we think, there is a lot to be gained from technology. We will always work with the state of Ohio. We are a state-supervised, locally administered system. we may call the shot and on implementation, but these are the state's tools and resources, and they define the policy. And so I think the other, beyond customer service, the other thing I just would leave you with is our relationship with the state of Ohio is excellent right now. We did take a leap on this call center, by the way. The cost to us, the out-of-pocket cost to have this call center for SNAP and Medicaid and TANF was nothing. We took the state system. They offered it to us. Others said no, we said yes, and we've now implemented this system without spending county dollars on a county system.
And just
That's the
imagine,
value of partnership.
and just imagine how many more people you would need if you were still at those 25-minute wait, because that whole system is queuing up there, and it just becomes a mind-boggling. So congratulations to you. This is an example of, I hope that others look at it, how we can use technology to the best interest of where we're going. And again, the people who are on the front lines, I guarantee you, they are just a wealth of knowledge. They are just miraculous as far as what they can do. And when you ask them, how can we take this to the next level with new technology, they'll be your best resource.
And I hope that some of them will move on. We want as many of our staff to stay with us, but this call center environment is real. And this is great professional opportunities. And we are seeing people already move through our organization, and some will leave our organization, but they will leave with skills that I think will carry them far. Might carry them across the street to a call center there that, takes them from being a direct service employee to a supervisor, to a manager, to administrator. And so we're really proud of them as well.
Well, you referenced a couple times the sector partnership. I know that the manufacturing sector partnership, I know a little something about what's going on there, is directly trying to drive the folks from that level, whether they be working in hospitality call centers and moving on over to a higher level paid job, they're working in incarceration, or even from county jobs from that standpoint. If they can move from our payroll up to the 15, to the 18, to the 22, I can tell you that's exactly the target that we're wanting to partner with from in the way that sector partnership is designed to be working out there. So I applaud you.
Thank you.
Okay, Ms. Simon?
Just a quick thank you. I appreciate all the work you've done. It was, experience of me calling to test the system, and people get frustrated and just hang up, and they don't get services they need. So the key is just to get someone, a live person, and then from there they can get help. So thank you very much.
If I can do an advertisement, if you're talking to residents and they're asking when to call, first thing in the morning is always the best time. That's the best time to reach us. The queues do start to fill up early in the morning. Lunchtime is the most challenging. Even though we stagger lunch shifts, we're still going to be out at some point. Most of our staff are going to take a lunch. They're entitled to that. And so I would ask you to keep, as you talk to residents, to please, if they have bad experiences, let us know. But, again, I just have to turn the compliment. I understood we put you in a difficult position when residents would walk to you and say, I can't talk to anyone, and no one could respond to that. And so we still recognize 16 minutes is not acceptable. It's better, but we also believe it's an average. Some people, there are some bad days. Somebody may sit on phone for longer than an hour. We hate that. But if it's a snow day and people called off, it's going to be a bad time for us. There are also times people sit on the phone for a minute. And that is, if you factor in the travel time that we have saved, them getting in their car, coming down, sitting with us, and then going back, we feel like for the majority of clients, we're doing better. And I really do applaud you for, giving us very direct and sincere feedback.
Okay. Okay, well, one thing that we can give you personal credit for is doing very well at coming in on short notice and filling in for the director. You did it very well, so thank you very much.
Thank you very much.
Okay, we are now going to call forward our last presenter for the day from the Office of Child Support Services, Tiffany Dobbins-Brazelton.
Good afternoon.
Good afternoon.
The Child Support Program encourages responsible parenting, family self-sufficiency, and child well-being by providing services to locate parents, establish paternity, establish and modify and enforce support obligations, and the collection of child support for children. The Office of Child Support Services budget is approximately $44 million with 319 staff, which is inclusive of the Fatherhood Initiative Office. We have collections averaging $229 million per year and serve over 139,000 children. We are funded with federal Title IV-D match dollars at 66%, federal incentives, medical incentives, administrative fees, state match, and Health and Human Service levy service dollars. The Office of Child Support Services expenditures portion of the budget includes a 2% cost of living increase, 14% reduction in employee health care costs, 5 cooperative agreements. We are not reducing or eliminating any existing programs, initiatives, or services. We do not have any new initiatives or increased expenditures beyond what was added to our budget in 2019. And we believe this budget is manageable for us for a 2-year period and have no concerns with the 2020 to 2021 budget. Our staffing levels at this point are doable. We don't ask for a decrease or increase. We don't seek that. And we seek no more funding from the HHS levy at this time.
And did you have any decision item requests that were submitted to OBM?
Thank you, sir. My apologies for that. The only thing that we had that was not provided was the parking request for staff.
Okay, we already discussed that.
Okay.
Okay, fine. Okay, questions? Ms. Conwell?
To the chair to director, what is the case sizes per child support specialist?
Per
Caseload,
specialist?
caseload.
Caseload per specialist?
Yes.
I do not have that at this moment. We do have we operate differently with 2 departments. So one of our departments, which you call case maintenance, they have a case banking look, so that's where.
They call in and things.
Yes, and it's shared amongst several folks versus our compliance department, which is really, we call it non-paying. That's where individuals have a caseload size. I can get those numbers to you for compliance and let you know what the case maintenance, but it changes based upon if it goes into a paying status or a non-paying status, if that makes sense to you. Okay. And we have a couple of other departments there in between, like our early intervention department or our new order unit, where those cases may be shared, and then we try to move those along.
Okay. So if they become compliant, then they move to the case banking system.
So, yes, in case maintenance, correct.
Okay, so I guess what we would need is the total numbers of cases that you have in the compliance department and how that fluctuated through just 2019. We don't need to go back further, just to see, because you're not asking for an increase in employees. So, and how many, I guess, case managers do you have per case to handle these?
Okay, we have a total of 195 support officers.
Okay, we got quite a few. Okay. All right, thank you.
And Director, what's the current percentage of obligations that are being paid on time, and is that percentage increasing or decreasing?
Actually, we had a better year this year. We're just under 64%. With that, and this is the first year the state actually reached a 70% goal of reaching current support levels. That has been a target for the state of Ohio for 7 years now, and we just reached the goal. We just received that news last week.
Okay, I remember a number of 62% in the past, so it looks like you've gone up a couple percentage points.
Yes, our goal was 64%. We were disappointed that the last month of the federal fiscal year, we didn't make it, but
We came very close.
Yes, sir.
Okay. Other questions?
Mr. Chairman.
Yes, please proceed.
What are some of the biggest challenges in this department?
The challenges are working with our parents, and especially parents who pay. So over the course of the past few years, the rebranding of child support as a program from a federal level down to a county level, and we've been part of that initiative in trying to change the way we enforce support orders. So to answer your question, challenges jobs, the ability to pay. So there's a difference between someone who just doesn't want to pay and acknowledging someone who has barriers with jobs or the education to be able to get a job where there's self-sufficiency and they're able to have a sustaining wage. So that's where we've been working toward our programming in terms of how can we help remove those barriers and help connect people with the services they need. So we're working with like our Fatherhood Initiative program. We also do a Family Force demonstration grant at this point. We've had conversation and we connect with Skill Up at points. So there are different various ways we look to see what services we can help. We work with the Homeless Services Department as well as reentry. We work on reentry. We have a special caseload for that. And so we look to see how we can better our services with helping those participants in the child support program.
You mentioned the Fatherhood Initiative.
Yes.
2 years ago, their budget was cut. There was a cut to the Fatherhood Initiative dollars. You mentioned that there is no ask for any additional dollars this time. And I couch that in the context of, again, the Nia Day Garrett case. And maybe the Fatherhood Initiative, I believe, could play a type of role, I guess, in that type of situation.
I understand.
Okay. What was that budget amount cut to the Fatherhood Initiative last 2 budgets ago?
Sorry.
2 years ago.
Turn to some assistance here because I'm not familiar with that. 100,000.
Directed 100,000.
Yes.
Okay. Thank you.
Okay, thank you.
Ms. Simon?
Brief question on the new child support guidelines, and is that impacting your staff and the demand for help from obligors or?
We are still assessing that data to see how it has impacted. What we have been instrumental in doing is getting the information out there to let individuals know that, as you know, that was a huge change and long overdue. So that's what we're trying to just give it some time and go back and revisit the data to see how impactful it really was as far as impacting what's going on with us internally.
Are you increasing the administrative review to capture the change in the numbers, or are you still going every 3 years generally?
Every 3 years, or what other, any other options that make it, when it's time for us to do so, then we go ahead and do that. What we've worked on as well is our timeliness in terms of getting those reviews done, because we know how it impacts when a person goes in arrears or vice versa, even if you can't afford, the last ordered amount and the way it's impacting the numbers and the credit reporting and so on and so forth, so.
Yeah, it could cut both ways,
Yes,
I know.
Yes.
So, Director, I missed something somewhere. What is it that changed that impacted your department?
The House Bill 366 guidelines changed. So the guidelines, which that's the way that the support is determined, the amount of child support that's going to be paid is determined. And it had been, I used to know the year. I'm sorry. Go ahead. It's like 98 or somewhere around there. Yes, the last time
98.
that we so basically it was outdated in terms of what applies to today and looking at income and coming out with what a person, an individual is responsible to pay. And so it wasn't relevant for the current time.
Understood how that would impact what goes on in your department?
Yes.
Okay.
Yes.
Anything else?
Just that they've done a good job being in the lawyer community, communicating, and your summit, workshops and whatever. You've done a really nice job through your agency.
Thank you so much. We have had a focus on that, so I'm happy to hear that. Appreciate it.
Okay. Thank you very much. That's it.
Okay, thank you all.
Okay. I would like to remind everybody to please send the written remarks so that we have them on file. Send them to Ms. Schmatzer. And I would also like to say that that the departmental presentations today were concise and well focused. You gave us the essential information. You focused on the budget questions and on what was changing and what was requested, and I couldn't ask for anything better. You gave us the information that we were looking for, and I would just say to all of the other directors that are about to come to follow their lead. They showed you how it should be done, so I'm appreciative for that. That made our job much easier. Is there any miscellaneous business? Hearing none, we stand adjourned. Thanks very much, everybody.